the therapeutic and diagnostic use of adenosine. Adenosine is an antiarrhythmic drug for the rapid treatment of supraventricular tachycardias. Adenosine suppresses atrioventricular conduction, which makes it very useful in treating paroxysmal supraventricular tachycardia, in which atrioventricular node is part of the entry pathway. Adenosine also are utilized in cardiac imaging during stress tests due to its vasodilator properties to determine coronary fractional flow reserve and to assess pulmonary vasodilatory responses in patients with pulmonary hypertension. The administration of adenosine is that the adenosine is administered either as bolus intravenous injection or as an intravenous infusion.
Mechanism of action of adenosine. Adenosine arouses when there are large amount of ATP hydrolyzed and especially if there is insufficient oxygen available where some AMP further dephosphorylated to adenosine by cell membrane associated enzyme 5' nucleotidase. Mechanism of action in matching coronary blood flow to the metabolic needs of the heart. In coronary vascular smooth muscle, adenosine binds to adenosine type 2E receptors which are coupled to the G protein. Activation of this G protein stimulates adenylyl cyclase, which increases CAMP and causes protein kinase activation. This stimulates KATP. This stimulates potassium ATP channels, which hyperpolarizes the smooth muscle, causing relaxation. Increased CAMP also causes smooth muscle relaxation by inhibiting myosin-like chain kinase, which leads to decreased myosin phosphorylation and a decrease in contractile force.
Mechanism of action in supraventricular tachycardias. In cardiac tissue, adenosine binds to type 1 A1 receptors which are coupled to G proteins. Activation of this pathway opens potassium channels which hyperpolarize the cell. Activation of the G protein also decreases the CAMP which inhibits the L-type calcium channels and therefore calcium entry into the cell. In cardiac pacemaker cells located in the sinoatrial node, adenosine acting through the A1 receptors inhibit the pacemaker current, which decreases the slope of phase 4 of the pacemaker action potential, thereby decreasing its spontaneous firing rate. Negative chronotropy. Inhibition of the L-type calcium channels also decreases the conduction velocity, negative dromotropic effect, particularly at the atrioventricular nodes, producing atrioventricular block. It is important, however, to know that when adenosine is infused into humans, heart rate increases because of the baroreceptor reflexes caused by systemic vasodilation and hypotension.
The side effects associated with the prescription of adenosine includes dizziness, flushing, headache, and belly pain.
Digoxin, also called as cardiac glycoside. It is used to treat many heart conditions such as atrial fibrillation, atrial flutter, and heart failure. It can be administered by orally or parenterally.
The mechanism of action started off by inhibiting sodium-potassium ATPase on outer cell surface. This will lead to higher intracellular sodium concentration, thus the efficacy of sodium and calcium ions exchange. This will cause the intracellular calcium ion concentration to increase. As it increases, the contractility of heart will increase and reduce heavy conduction. As a result, heart rate will decrease. The indication for this drug is tachyarrhythmia, while the contraindication is ventricular fibrillation.
Patients who are pregnant or have electrolyte and fluid disorder or cardiovascular disorder or renal failure need to be extra cautious when taking this drug as it may cause harm. The side effects of this drug are gynecomastia, which is enlargement of breast tissue, fatigue, nausea, vomiting, anorexia, and bradycardia.
Magnesium sulfate is used to treat certain abnormality of heart rhythm. The main disease that use magnesium sulfate is torsades de pointes in cardiac arrest. It is administered parenterally. The mechanism of action is decreasing the calcium influx to prevent early after depolarization, which is EAP. EAP is a focal event that occurs during the action potential of myocardial cells and disrupt the repolarization that can trigger a reentrant impulse. The indication for this drug are torsades, the pointes, eclampsia, constipation, and tocolysis. The side effects of this drug are low blood pressure, skin flushing, low level of blood calcium. Other side effects are vomiting, muscle weakness, and short breathing.